if you break it down to per capita cost for the whole country, it's about $1,500 for every man, woman, and child with a pulse in this country. That's what's coming out of our GDP, basically.
Mm-hmm. And this is addiction alone?
No, it's substance use, not just addiction.
Okay.
And that's the thing that I think we need to really help people understand. Because they look at addiction and they think, well, I'm not that guy or I'm not that girl. I'm not using needles. I'm not living on the street. And so they don't look at themselves and see that there's an issue. And what I've been trying to do for years, and I think what we've been doing fairly regularly with this show, is starting to get people to look at earlier identification of problems. Like one of the statistics is that about 20% of the population misuses alcohol. Like, that's a lot of people. And that starts to make a difference. So if we could pop up that first slide and just take a look at that. So that's substance use attributable overall per capita costs for the country. And the drug that costs the most money is alcohol. And the drug that gets the most attention is opiates. And it's about a third as much of a cost to society as alcohol. And if you want to pop the next one up, this looks at the prairie provinces. And Alberta and Saskatchewan are higher than other provinces. We have a bigger problem than lots of places do. And I don't think we're doing a good enough job of educating people about what a substance problem is. And if you can pop the next one up, that's me. So that's healthcare costs. So
per person, is that what we're saying?
Yeah. Per capita cost is per person. The green is Canada. The yellow is Saskatchewan. So we've got higher costs in this province related to alcohol, tobacco, cannabis, opiates, central nervous system depressants, cocaine, and other central nervous stimulants, so that includes like crystal meth and stuff like that, than the national average. So what's going on in this province with people's attitudes towards substance use is it's off base. People aren't thinking about this carefully enough because they're looking at things like, I'm not as bad as, and there's a terrific amount of normalization of excessive substance use. And I mean, I don't want to get into the COVID thing now, but I mean, there's been huge pressure to keep the bars open. Liquor stores, during the first cycle, were declared an essential service. And I'm not saying they shouldn't have been, but what that indicates is that wanting to be able to access alcohol is extremely important to people. And I think the question is, does it need to be that important? And, if you can't regularly go without alcohol, maybe that's something that you need to take a look at. Mm-hmm. But people, if they're not the town drunk, then they're okay. So they don't really look at what's going on. But it costs a significant amount of money. We had the justice costs and so there's the justice costs, and that's Canada. And again, alcohol and Saskatchewan's on the right. Alcohol in Saskatchewan, their justice cost is higher than national average. There's no justice cost with tobacco because you don't get in trouble for smoking in your car. You don't get in trouble for smoking at work. Like, there's no justice cost with it. But it is health-wise, it's a significant cost. So what this study has done is pull together a huge body of research on all of the different areas of society that substance use is impacting, and it's on csuch.ca, which is a searchable thing. So you can look up a particular drug in a particular province and see exactly what that is costing. And I think if we can help people understand what those costs are, because it affects how much you're paying in taxes. Like that $46 billion that is costing the Canadian economy is coming out of a lot of taxpayers and a lot of employers' pockets.